All right, it's about 5 after, so I think we'll get started here. This is Daniel, and one of the co-hosts for the Let's Get Technical group here, and welcome to folks who are returning, and welcome to new folks who are on the call. We've been meeting now for, so I think 6 or 7 weeks, and are making some interesting progress on having meaningful conversations around technical conversations, and also trying to sort of map out what this kind of technical multidisciplinary group is interested in doing and contributing to the field. And so what we've done, what we're doing today, let me share a screen with you here, or let me advance rather. Next. So today's agenda is the following, or at least this is the proposed agenda, at least as we've been thinking about it. So it's a continuation of the conversations we've been having. So we have a little bit of a tradition of introducing new participants. If there's any new folks on the call, we'll ask you who you are, where you're from. And just a very quickly an identification of if anyone's going to any of the upcoming conferences next week. It seems like there's a preponderance of activity next week across the country in terms of related kind of conferences. I know we had talked about that last week. You might want to just identify yourself if you're at a conference, and if there's a way to sort of connect up, that would be great. I know there was some interest in that. I am not going to do an overview of the National Interoperability Collaborative at the start. We'll do some of that if we have time at the end, and I'll come to that in just a second. So I want to focus our conversation today on where we ended up last week, which was to discuss a framework for a particular part of the interoperability universe here, or ecosystem, which is around what we talked about, which was patient or client matching. A very sort of focused conversation around that, and as a way to see if we can demonstrate how sort of a virtual team can become a work group, and see how we can make some progress in really meaningful cross-system, cross-domain areas, which is in many ways the foundational part of this work here, is to look across domains. So between health, human services, public safety, education, all those kinds of things. And we have a good representation of at least some folks from each of those, I think all of those domains or most of those domains on the call here today. And we will have a conversation. We're going to do a virtual fishbowl conversation. So coming out of last week's meeting, there were several people who identified themselves and volunteered to be part of the first inaugural work group. And Pradeep Padilla offered to put a straw person together that we can talk about relative to patient-client matching. We want to focus our attention on that. We had a little bit of a conversation on it earlier, and opened it up to conversation within the project team and then the broader participants who are on the phone here. And we'll look at that template as a way to bring visibility to the topic and see how we can work together. And then we'll talk about some of the other project team opportunities in addition to going more deeply into the patient-client matching. The other couple of topics we have identified so far, including identity proofing and authentication and standards building. And as you know, we've spent some good time on the NIM and the FHIR standards. And sort of going right into that, yesterday there was a NIM conference, which several participants on the call today were at. Brian, Paul, and Dave, maybe others, I'm not quite sure. And we thought a brief overview of that, because that did address some of the topics that we've been grappling with over the last couple of weeks on the role of NIM, the role of FHIR HL7, and where the twain shall meet, and where they can be complementary or provide unique value and solutions. And then that leads right into a conversation around governance and how this group is evolving. And then, as I said, just a few minutes on the actual collaboration site itself. We'd love your thoughts on how it's working. If you've been able to spend some time on there, we have the ability to configure and change that, and we want to make it as responsive to this group and people as we can within the confines of the platform that we're using, which has good functionality, not perfect. So we want to make sure it's valuable, and if we're doing stuff that's if we can do stuff that's additive, that would be terrific. So that's the agenda right now, and what would be terrific is if folks who are new to the call can just identify yourself and give us just a little bit of who you are, where you work, what you do, what your interests are, and feel free to jump in. One of the pieces here is because we're trying to keep this an open, active conversation, people will inevitably talk over one another, and that's fine. But just be bold and speak out. So, Eric, I just saw you took yourself off of mute. So, why don't you go first?
Hi, good morning. This is Eric Burden. I am with the United Way of the Mid-South in Memphis, Tennessee, where I work with our Driving the Dream initiative as our Associate Director for Data and Quality Improvement. We run a network of community-driven connected agencies who are sending referrals back and forth across a database platform, similar to what you guys have got going on with the CIE, and we are trying our best to move further in that direction. So happy to join the call today and to participate with you guys. I've had the chance to watch many of the previous talks, but this is the first time I've had the space on my calendar to join live. So glad to be here.
Terrific. Welcome, Eric. We actually visited Memphis a while ago in a large meeting around Driving the Dreams. I don't know if we met that day or not, but
I think in passing, but there were a lot of people here that day. So
yeah, great. Great to meet you. Who's up next?
Hi, this is Hudson Harris. I'm from San Diego. I work predominantly in the mental health design field, but my background and chops are all privacy and HIPAA, GDPR type stuff. Also a California attorney, have just kind of pivoted some of my career focus to be on mental health and healthcare system design.
Welcome.
Thank you.
Any other new folks on the call haven't introduced yourself in the past?
Yep, this is James Nolan from the Michigan Health Information Network. I was sort of passed an invite from our executive director, Tim Pletcher, and interested, obviously, in supporting efforts that you guys are talking about related to patient-client matching and that framework.
Fantastic. Terrific. Anyone else?
Hi,
Yep.
This is Sharon Jacob from Hudson Center. We're based in Tarrytown, New York. And my CEO, George Ann Chapman, actually introduced us to the Steward of Change and NIC.
Great.
And we're just interested in, seeing how the discussion goes.
Fantastic. Welcome. That's great.
This is Neil Holt, Director of IT for Arkansas Share, the state's HIE down here in Little Rock.
Welcome back. Great to have you. Anybody else new to the call here, or just wants to introduce himself?
Hello, I am Mayor Antoine. I am a CDC Informatics Fellow.
Oh, great.
Working on global health. I'm a colleague of FIDIP, so I'm working on matching on the global health for HIV.
Fantastic. Glad you can make it. Anyone else? Okay. So we'll get moving here. As you know, if you're on the Zoom platform, hopefully you can see the screen here. There is some functionality. We've got some chat functions going here. If you have questions, you can add them to the chat. If you have comments you want to make, just jump in and make your voice heard, so we can make sure we hear from you guys there. Okay, ambitious agenda here today again. So I think I've got this group right. This is these are the folks who have offered and participated in some ways on this first initial project team. So, and again, everybody should be on the hub so that you can look more deeply into their bios. And I encourage you all to fill out your sort of your who you are and what you do and where you're working from. We've got a lot of activity on the hub. And just very briefly, we've got about 700 members now who are on the various parts of it, and we are continuing to expand that as we go forward. So you'll find a lot of resources there. And I just realized, with a little bit of encouragement, that Noam Arts is also should be on here. So I'm going to add you, Noam. Thank you for stepping up and letting me know that. This, again, is a bit of a just-in-time thing. Anybody else, feel free to let me know, but I will update this and appreciate the time for everybody's participation. And so with that, what we're going to do now is we're going to kind of pivot to this client patient matching template, and that will be part of the conversation we're going to have. And what I'm going to do is I'm going to ask Pradeep to, let me see if I am sharing this, new share. I'd like to ask Pradeep to at least introduce the template here and kind of give us a little bit of his thinking about what the categories are. The objective was to see if we could get down on one piece of paper an initial draft of what are the key items, attributes, components of patient-client matching that would be relevant for any or all of the domains that need to exchange information with one another. So it goes clearly beyond healthcare, and we ideally would be able to address any of the patient-client matching needs that would come out of whether or not it's human services or public safety or education. Those things would be really, really, really relevant. So Pradeep, let me hand it to you. I think everybody should be able to see the screen here. And if you don't mind just kind of giving us a little bit of thought on that. Oh,
sure,
okay.
absolutely.
Great.
Thank you, Daniel. Happy Friday, everyone. Thank you very much for taking the time to join the call. It's really exciting to see so many people on this call on this important topic that we are trying to deal from different perspectives. Thank you very much. So on the screen, what you're seeing, this is a template. Trying to think in a linear fashion when it comes to patient or client matching as to what are the important topics that we should be thinking about. And again, this is only a draft version of it. So please feel free to share any comments or thoughts, and we are happy to make those edits and revisions as we go along. So thinking about the area of focus here, which is patient and client matching, the key thing is, as I have been doing some research on this topic, and I came across 4 different books related to identity management, record linkages, entity resolution. There are so many ways in which this domain is being referred to using different keywords. So one thing to start with is to identify what are the different keywords that people are using in different domains related to this overarching topic of patient and client matching. And at the same time, I mean, we could use some of the definitions that are out there, or we could come up with our own definitions as a part of this group to describe those different terms that we are going to use, or we will be referencing to. And the next one is thinking about the domain focus. Is it healthcare related, non-healthcare, or generally applicable? Because in the healthcare itself, we are trying to look at different domains. Is it within clinical to clinical or clinical to community, or what exactly are those going to be? And because the dynamics of the linkage changes with the entities or the participating sites involved in this client or patient matching. And how generalizable is it? That's another most important thing to consider. And for example, within the healthcare domain, there may be different considerations when we are depending on the patient population or cohort under a cohort of interest. Is it applicable to the entire patient population that a hospital or a healthcare entity is serving? Or is it only specific to pediatric patient population, because pediatric patient population, for example, has its own challenges. Pediatric patients do not have any financial transactions, and there may be some dealings with their naming conventions, as well as, I mean, if there are twins or triplets, I mean, how are you going to distinguish them? So pediatric population has its own challenges, and in some instances, we will not be able to use social security number if their age is under 18 years for their matching. And adult population, or in general, I mean, does it apply to overarching population? Now comes the important topic of what is the approach that we are trying to take here in order to address this longitudinal patient record. Is it going to be deterministic based on clear text data, or is it going to be probabilistic based on different terms that are being used, or rules-based? In some instances, it can be like privacy-preserving record linkage, where the data is being encrypted before it leaves the firewall of an organization, if it is like a partnership that is there in order to build this longitudinal patient record, or an advanced machine learning. For example, most recently, Picornet went with the DataVant in order to do their patient linkage across the distributed data network. So that's an interesting thing to keep in mind. And also, at the same time, another important thing to consider is what are the metrics that we are going to assess the approach? I mean, when can we say that our approach is making sense and able to identify most of the matches? What are the metrics? Is it true positives? In some instances, the same is referred to as true matches, and recall, precision. What exactly is it that we are going to take into consideration, and what are the metrics, and how do those metrics change depending on the domain of interest here? That may also change. Then comes the metrics for the assessment of the system requirements. How long does it take to process N number of records? How long does it take to process, for example, 10,000 records or 1 million records? So that's also a key consideration. And what are the limitations that come with these softwares? I mean, depending on whether it's an open source or a closed source, the softwares have their own limitations when it comes to the package that is used to build that particular software. And trying to identify some use cases and build up some references. So again, this is thinking in a linear fashion on the topic of patient and client matching. These are the domains that we came up with as a group. So any thoughts or any feedback would be greatly appreciated. Thank you. Thank you, Daniel. Thank you, everyone.
Thanks, Pradeep.
Thank you.
So you'll see that there are some considerations of things that we started to brainstorm just as we reviewed this just a little bit ago. So what I'd like to do is I'd like to invite the project team to elaborate a bit on some of the areas that we thought might be also of importance to include in this matrix, or even a sort of a variation on the matrix. So do I have any volunteers to sort of kick off the conversation here? You guys were all so chatty a moment ago.
Sure. Yeah, I can take a stab, Daniel, if it is okay. Sure. Yeah, and as Daniel mentioned in the introduction, it deals with the different specific domains that are of interest to us. Is it whether we're dealing with the human services, public health, education, public safety, EMS, or healthcare? And also, it also deals with, are we dealing with covered entities and non-covered entities? Because that's also an important topic when it comes to data use agreements or memorandum of understandings, because we are also dealing with confidentiality and privacy and protection of the data, and the cost associated with the open source and the closed source softwares. And even though it may be open source, but it may also need some edits that needs to be done. So some kind of cost will be associated with the open source softwares as well. And while we are dealing with the patient and client matching, something that would be of interest is the naming conventions. How do those naming conventions change? Some naming conventions may be different depending on the region, depending on the population that is currently over there, or the transition of the population into that region. And taking into consideration mother's maiden name when linkages are done for pediatric patient population, as well as the I'm sorry? Yeah. As well as some temporary names that are created for kids when they are born, like a baby boy, baby girl, and it's like converting. How do you actually map it back to a correct name or a finalized name of the kid? So, and also dealing with pediatrics like twins or triplets. How do you distinguish boy A from boy B? So, how do you do that? So, yeah, those are some of the things, and if someone would like to pitch in and share the other things, yeah, thank you.
Yeah.
Hi, Noam Arts. I'm having a little trouble getting my head around this. I guess I see how both the column, labels and some of the considerations below are all good factors to try to scope and understand this problem. I would say there's also a good bit written about this problem, so I'm not sure we need to reinvent the wheel here. I guess I'm having trouble understanding what a row means. So what is it that would be in a row? Because the two examples you have are sort of the broad buckets. Mm-hmm. So if you wanted to describe each of the features in the column just for each of these two rows, I wouldn't put it into a table. I'd just write a little paper about it because so what are the rows?
Yes, the rows here are just to distinguish between the different areas of focus that we are discussing, and the rows here are just highlighting the different topics that come within this domain, like in a linear fashion. So it doesn't have to be exactly a row. So this is just a draft, working draft of some ideas, some abstract ideas that we are having on this topic.
Okay, so then what would be in a row of this table under the area of focus patient-client matching? A particular solution? A particular approach? I'm just trying to understand how we're thinking about this.
Absolutely. It will be like a particular solution on an approach, for example, a healthcare use case or something that was done, so that we can highlight some of the results that came out of that effort.
Right, but use case is a column, so it can't be a column and a row at the same time. So again, I'm not trying to be obnoxious. I'm just trying to push you a little to think about, well, what this structure that you're showing us really is, and is this the way to capture whatever it is we're trying to capture?
I would like to suggest that the rows really need to be and to show the variations in the columns. The rows could be most helpfully distinguishing between the people who are volunteering to provide their identity in order to get services versus those who are attempting to hide their identity as another row versus those that are unknown, which would include, children and undocumented people and those who just don't have the conventional data available. Because each of those columns are different, the approach and the metrics and limitations and use cases vary as a function of the kind of people you're trying to identify.
Or they may be different. I don't accept that they're necessarily different. They may be different.
Right. Okay, I'll buy that, but they're certainly worth looking to see whether or not they're different or similar.
No, that makes total sense. Yeah, thank you for the feedback. Absolutely.
I also think, and I'm just trying to, sort of capture the thinking as we go through here. So, Paul, you're saying, voluntary, versus involuntary, compulsory, and then the sort of people not wanting to share their identity at all as one cut of it, because you would have definitely different. You might have different kinds of information on that. Is that accurate in terms of what your suggestion is there?
Yeah, well, I am quite sure that the approaches in terms of the parameters used to identify people are different between those who want to be identified in order to get their records linked versus those who are trying to hide their identity so that they can't be linked, which is in the case in the public safety world where criminals use false social security numbers and change their names and change their date of birth. There are a number of factors used to identify people in healthcare that are dependent on people accurately saying who they are and where they live and what their age is and so on. In the criminal world, people don't use social security. They don't use last name or first name because middle name's a more accurate way to match criminals. They may start with the name, but it's rated as less significant in the criminal world. And the children, of course, don't have those data, a lot of that data that you use for adult matching.
Mm-hmm. So this is Crystal in Washington State, and I would submit that this is a complicated enough problem that we don't necessarily need to characterize folks that we're trying to identity match as criminals if we can't match their identity. There's a bunch of reasons that, totally benign reasons, that data could be inaccurate or not match, expected parameters. But I would strongly object to the use of the word criminals in any of our communication regarding patient matching.
I don't necessarily think you need to use the word criminal, but matching that's involuntary as opposed to voluntary makes different solutions appropriate. One of the things, when we're talking about interoperability, one of the problems that came up yesterday in the NEAM healthcare discussion from the PDMP program, who are attempting to do identity matching across state prescription drug monitoring systems, is the difference between how they do matching of people versus how healthcare matches are typically made. And the whole problem, if we're talking about interoperability between public safety, education, health, human services, are we looking at how do we resolve the different ways to do identity matching when we talk about cross-domain interoperability? I agree that it's complicated enough to take each one at a time, but you got an additional layer of complication when you're talking about cross-domain identity matching.
So I think it is very important that we have a way to identify when an individual is providing consent for interoperability, meaning cross-domain permission for communication and different types of exchange of data. And that's a completely different set of regulatory requirements or opportunities than if it is not with the patient consent, it is with the rights of someone else. So I think that's the critical piece, whether it's criminal or not, is not as big a deal as that we keep track of what can be done with patient or individual's consent versus what can be done with the rights of different organizations or other individuals.
So that's interesting as another way to cut this thing, right? So I'm just thinking about children, in child welfare, who's the state has custody over their records, or people who are unable to make their own decisions, right? That's what you're talking about, Marcely?
No, I'm talking about, well, that is, I would say yes, that is also part of it. As an individual, as an adult, I can consent to the exchange of information between, I can take my right as a patient and then provide the access. I can create the pathway through my individual right to access but I have to be able to have documented where that permission is and that it was meaningful and that I understood. So there has to be that extra check and balance. But if I am not the patient, if I, the patient, am not giving consent, then there has to be a documented reason why someone else would have access. There's a lot of different rights. Payers have different rights. Confidentiality components have different rights. So if we keep track by the regulatory functions, I think it'll make it easier for us to figure out the path, the crosswalks moving forward.
Well, I think that's definitely a factor, but there are a lot of situations where organizations want to do identity matching where consent is not required or at all.
True, but we were talking about what are the components that are involved when you are trying to figure out who's whom. And so there are ones when individuals are providing the opportunity for interoperability versus when is it organizations.
So there's some differentiation. I think it's, again, this, we don't need to resolve all the details here, but there's, again, a different cut at it where you individually are doing that versus somebody else on your behalf or somebody else, not necessarily on your behalf, but are trying to find out who you are. Those are obviously different kind of approaches to it. That's an interesting cut. Other thoughts? Noam, back to your point about the rows, one of the ways I thought about this is maybe while we have domains or focus here in the third column, I wonder if another cut, because I think this could be actually a three-dimensional, as I said, or as I was thinking, almost like a pivot table, where you would have each of the domains, because one of the things you'd want to look at is between healthcare, human services, public, education, those things. Would those make up the rows? And that way you could look at seeing in a glance, basically, you could see whether or not we're even referring to it in the same way. Are there the same definition? Are there, who's the target of those? Again, just you work across the matrix here, and then you could cut that in different ways as well, based on voluntary, involuntary. There may be various ways to cut the information. So depending on where you're coming from and what your needs are, you can identify what the driving factors are or the influencing factors on identity management or matching.
Yeah, I think what you're really getting to is that there are multiple things sort of lumped into these columns. So I think one cut on this would be, yes, where the rows are sort of those domains, but then some of the columns should also fall away, because I think the middle columns that talk about, if you can scroll back to the headings, I'm sorry, I know it's hard to type and look at the same time. The middle columns, approach, metrics, those are actually the attributes, I think, of solutions. So I think there may actually be multiple tables here. One may be a table of domains and some attributes about those domains, the use cases, the populations, keywords. The other may be solutions, because those solutions could apply across domains, and that might be the approach, the metrics. So there might actually be multiple tables in here because they're measuring different things. That's why I suggested we think about what the rows are.
Sure. And another thing I would like to add here is, as we are thinking about domain coming into the rows, another subsection of the rows can be the different population or the population of focus, which can be adult, pediatric, or adult, or is it general population. So that can be another one. So technically, columns 4 and 5 could be actually taken off and converted into rows.
Yeah. Interesting.
Daniel, it might be worth considering what are the organizations that can no, or so if it's not individuals who are consenting to have cross-sector communication regarding them, then what is it that allows it to happen? And only pick things that can be done that the policies allow as the pilot.
Say just a bit more about that. I'm not sure I totally
understand. So if we were commercial entities, let's say I'm just going to be selling you something. In the commercial world, there is so many granular ways to be able to identify me and what I want and how likely I am to accept what you're giving me. Mm-hmm. There's so many ways, the type, how fast you type and where you type and unique identifiers, there's probably, I don't know, thousands of different ways for me to be identified. But that's because I've decided to be a consumer. When you start talking about different sectors like healthcare or education or human services, there are lots of different rules that do not allow one sector to reach out, knowing that person, who they are, where they live, their contact information, and recommend, basically advertise or combine and connect those dots. So when we're looking at what is it that the pilot is going to execute, we want to pick the things that are already allowed. If it's going to be like a county, what are the services that are allowed from the county, regardless of whether the proprietary software will do it, or what are the services that are allowed. And then if we go through the policies and map out the policies, it'll make it easier. Then we'll know what cannot be done with or without, or what must have or does not need the consumer or the individual's consent.
So one of the things that we identified here was sort of the confidentiality privacy. I just added the point down here, Marcely, what data sharing is allowed. What's the impact on policy? I wonder if, without making this thing too unwieldy, I wonder if is that a column for folks in terms of the...
Well, you just put, and we scroll down there, you were just talking about a consent. Wait. So you were saying that you had data sharing is allowed. What was right before that? Data use agreement?
Yeah.
Okay, well, that's consent. That's someone knowingly, So that is the individual. So that's back to an individual providing the pathway. I don't mean to digress anywhere. I was wanting to make sure that if we're moving forward with interoperability, we know if we're getting there because it's allowed because we're county officials, or it's allowed because we are a patient or an individual living in the county. Because when you get to different sectors, different sectors can't just always reach out and connect. The policy is restricted unless the individual approves. So anyway, enough. I've diverted enough.
Great. Are there, for those of you who are deeper into this topic, are there those considerations in terms of the ability to share information, the sort of the legal, the legal requirements for that, the confidentiality and privacy? Is that something that we would be able to check the box on, or is that, let's say we were in a row, let's say we're on education. In order to be able to do client or patient matching, are there, should we be simply aware of the fact that there's FERPA out there, and that FERPA is going to restrict, that information sharing except under certain circumstances? My sense is I don't believe that everybody is aware of the, the overriding regulatory environment for information sharing within the other domains. I'm curious about how that's done now. And Neil, I'm wondering from your experience here in Arkansas, how are you, as you're going through the solutions, how are you guys dealing with that, or is it an issue that you've specifically addressed?
Great.
when I was getting ready to speak up, it's always something to consider. Now, different states, as far as HIEs are concerned, have their different rules. Either you're opt-in automatically or you're opt-out automatically. And when you're opt-out, that means your data can't be shared. Now that you know that, now let's reverse this, because Arkansas is what is called an opt-out state, which means you're automatically opted in the beginning, and that individual has to opt out at their doctor's office.
Mm-hmm.
Okay, so we will get the message from the facility and says, you know, this person has opted out, so then we continue to receive that information, and it is put behind what we call the glass. So the provider, clinician, whatever, would have to actually break the glass, because HIPAA states it has to be a TPO, treatment, payment, or operations reason to get into that patient's medical chart, not only just to look at if they come in your office, but also in an emergency situation, you have decided that you wanted to be opted out. Your information is still received. We put it behind the glass. All of a sudden, you're riding your Harley down the street, and a car pulls in front of you or whatever, and you go to the ER. You're unconscious, but they could see that, okay, they pull your license out of your wallet, they pull it up, they hit the button, it comes, it queries us, and then they go in and they have to break the glass to say, yes, this is a treatment, it's an emergency situation. So that's basically handled how it is in the HIE world. If you're in an opt-in state, then everybody's opted out, and then those individuals would have to opt in at their doctor's office.
Daniel, this is Noam. I fear that we're slipping pretty far down the rabbit hole here. I mean, if we want to focus on patient matching, then I think we need to focus on that, the actual problem of matching patients.
Yeah.
And perhaps avoid some of these myriad of ancillary issues about how you even decide it's appropriate to match someone. I mean, you know, it's just a very deep hole. And if we really want to focus on the problem of matching, I think we should strip away all the exceptions and just focus on matching itself in its sort of purest sense. Just my own opinion.
Other folks, I have a response to that, but I'm curious what other responses to that.
Well, I agree.
My thoughts are that there's people in healthcare, in the vertical of healthcare, that have been trying to figure out the matching components, and there's a series of issues around that and opportunities. There's an opportunity to look at cross-sector, which is different than patient matching. So if this is patient matching, then let's focus on healthcare. If it's cross-sector, then it will involve all those other questions that we just talked about with around consent.
Well, from my vantage point, I think that the value here, I mean, we don't need to try to solve this for healthcare. There certainly are plenty of people trying to do that right now. I don't think we necessarily bring what we bring to the table. I think the idea, and I just added that, is the cross-sector matching piece of it, which is, I don't know if that's being addressed anywhere. And that's the value add here, I think, is how do you do that across sectors? So you've got somebody, in a hospital, and are they the same person if you're referring them to treatment outside of the hospital for, social human services, educational, employment, whatever it might be? Are they the same person that you're dealing with? And I think that's in many ways the really the vital part of that. And maybe we put in patient/client. Maybe that's telling us the wrong I'm not sure there's a good word that just talks, aside from either person or individual, somebody who's involved in multiple systems. So I think we want to be mindful of that conversation as well. Because in the healthcare world, it's going to be patient matching, right? And that's going to indicate a healthcare point of view. So I want to go back to, I'm sorry.
It really makes sense to talk about person matching, I think, if we're talking about cross-domain matching of individuals.
Is everybody, anybody disagree with that? All right. I don't know if that makes folks on the healthcare side uncomfortable. If we're talking about person matching, cross-sector, or cross-sector person matching, maybe that's a better way of putting it, and from a goal perspective.
I don't know why that would make someone in healthcare uncomfortable. Why would you think that? I'm just curious.
Just because it just from a healthcare centric perspective, you know, the reference is patient always.
No, yeah, okay. So at least in my experience in healthcare, especially on the technology side, we often refer to it as person matching.
Oh, good. Okay, great.
So I'm not. It doesn't bother me.
That's terrific. I think that then expands it out, and I think it also highlights the fact that we are talking about, you know, more than just healthcare. So I think that makes sense. And I wanted to go back to your point again, which is around, you know, I guess you can break it into two. One would be sort of the voluntary. People are involved in systems. There is a voluntary versus an involuntary component, which is really important. But the question is, we're looking for the signal here around those. The majority of instances when we're looking to see if it's the same person in the systems that they're involved with. You know, they're receiving services in multiple areas. How do we streamline that? Paul, as opposed to not necessarily not to focus on that, but to differentiate that from the involuntary piece, which is, you know, whether or not it's a PDMP kind of approach or criminal or whatever that might be, or in the case of child welfare, you know, or involuntary commitment, there would be, you know, people who are, you know, we're wanting to match them, but they don't necessarily have it may not be totally voluntary in that situation.
You know, another way to look at this, when you start talking about cross-sector person matching, would be to have a matrix that had both the rows and the columns. Where are the different domains that we're talking about? So it's a 6x6 matrix. And then what you put in the cells is what are the constraints and limitations on, for example, law enforcement exchanging information or matching people with education. You know, you have a large cell that says what allows it, what prohibits it. And that's where you would enter stuff like FERPA and whatnot. And just describe that intersection between each domain and each other domain.
Yeah, and something to consider when we are thinking about the cross-sector matching is the minimum set of data elements that are available on the both sides to exactly identify the correct individual. So that can be another important topic when it comes to cross-sector linkages, because at least when it comes to healthcare, I mean, we are under the impression that there are certain standard data elements that are available for matching. But it really is a challenge when a healthcare entity, for example, is trying to match with YMCA, for example. So what are the elements that are documented? So that can be another challenge.
Right. I like the idea of, you know, as again, a sort of a separate or a different, you know, an additional matrix might be that that 6 by 6 that you're talking about, where you would actually have that, you know, that's where you almost get into the use cases, right? At least you know, 2 use cases talking to each other, you know, across in that 6 by 6 would give you the 2 use cases. Not necessarily if there were more intersections, I think you'd have a 3-dimensional piece.
This is Ford from ICE Cybersecurity speaking. One of the things I would add in there is sort of regulations and standards that apply uniquely to the domain. So, for example, 42 CFR Part 2, you know, in certain areas, and then any state or local or specific regulations that might be in there. I'm finding that a lot in these conversations. Is the equality of compliance context, if you will, is one of the big challenges.
Mm-hmm. Yeah, I think that would certainly, in my mind, that seems to be, that could certainly be a column, right? Where you, if you're talking about, let's say this first row was healthcare, you know, we would obviously have HIPAA in there, and whatever other major regulatory concerns there might be in there. Whereas for 42 CFR, you know, what are the ones that we need to be conscious of, and how are the solutions addressing those particular issues?
Yeah, if you take this notion of sticking to the cross-domain identity matching, you take this notion of the 6 by 6 matrix with the same rows and columns being the domains, and you could have a series of matrices, one of which would be the legislative regulatory constraints that keep, you know, education from communicating with law enforcement.
Are you saying that as an additional matrix, Paul, as a different way to cut the data? Yeah.
It could have this is a multidimensional problem. So you could have a multiple set of matrices, that one of which could be that, like Pradeep was suggesting, the data elements that are in common to go from one domain to another. Another one can be the statutory limitations on exchanges that have to be resolved, or constraints. Another one could be, you know, the cultural differences that constrain information sharing. I don't know what they would all be, but a series of matrices that deal with the major dimensions of this problem, I think would be an extremely useful thing for the field to understand that and begin to address those constraints and limitations.
Cool.
I agree. I think from speaking from a compliance and regulatory perspective on this, figuring out what the mandates are in the statutes, and then going back. One of the things that whether this group is tasked with that or not, or whether that's something we're just going to do as part of our business, is trace those back to the underlying standards. So if it's NIST cybersecurity standards or ISO or wherever those might be, the best practices, so that then that's how we find commonalities. And so if we say an organization A might be dealing with child welfare data, organization B may be dealing with just PII in California. But if we can all agree on NIST 853 or ISO 27001, then we can start talking to each other.
Great. That's like, do we have that, Pradeep, did we include that necessarily? I'm looking at that. No, I don't think we did we?
I was kind of assuming something like that would fall under the limitations column, but
maybe
that was just
yeah. I'm not sure what that means exactly, but that's great for it.
And I can get into depth on that about how the statutes and the standards, the regulations and the standards differ. The way that they work with each other, and you find different bodies that are trying to affect different outcomes in either social health or public health or social determinants of health, whatever. that, for example, 42 CFR Part 2 is talking about an implementation, and there's a delta of what needs to be done above the NIST 853 guideline, but much of what you have to do to comply with it from a security perspective traces back to those underlying standards. So it's a little more complex, and it may not be the focus of this group, but I thought I would offer that as if we could tie out to some of that stuff, that gives the common language, at least from a security compliance perspective.
Mm-hmm.
I think that's a very valuable contribution. I think those are important issues. If we're gonna foster interoperability improvements, we need to understand what those limitations are and how they can be overcome.
I agree. I think it's helpful to know what is not happening currently now because it's not allowed by policy versus what is not happening now because it's not allowed by a proprietary software. Mm-hmm. And for us outside of the software system, we really don't know. So it's taking the black box out and going, oh, well, the reason we're not doing that is for a business risk and because it's our company policy, because if we accidentally send this substance use treatment to the wrong person, it can knock out our, the risk is too big versus, well, we can't because it's actually not allowed.
Great.
Right, and if we can all agree on, let's say, the NIST risk management framework, then we can at least have an apples to apples risk conversation and then make informed decisions rather than just the big risk fear, everybody gets into the conversation about the edge use case, what if. Right. If we're having a conversation really around a risk framework, then we can move it forward.
That's fantastic.
I think it's a very helpful notion.
So let me propose, I don't want to cut off the conversation. I do want to get to a couple of the other topics. But before I do that, I want to ask, if other folks have other thoughts that they're sitting on that they haven't mentioned yet. And now would be a good time to do that.
And this is Pradeep. Yes. Since we are talking about cross-sector data linkages, something to think about is how is the data being transferred from these different entities like clinical and community? What is the mode of transfer? Because even that plays an important role. That may be the deal breaker when it comes to cross-sector linkages. Data sharing can be a major deal breaker.
So are you talking about the actual technical sort of manner? Is that kind of referring to?
Right. It's about, yeah, exactly. It's about, are we going to, is it something like encrypted data being shared, or is it clear text data that is being shared? Mm-hmm. To make the linkage, to facilitate the linkages.
Dave, is that what you were talking about in terms of the APIs? Maybe.
Sorry, I was on mute. That's a part of it, Daniel. I think as we're going through the topics that we're going through right now and previous discussions, it seems to me that there is going to be a plethora of solutions out there taking advantage of different technologies and so forth. So if we were to look at using a common API to be able to gain access to that functionality, I think we could do a couple of things. We could start to embrace new technologies, AI is an example and so forth, fairly easily. And to Neil's point, functionality like opting out, if you had a capability, a framework, if you will, or an API to say, Dave Walsh has opted out for this use case, that any products that are responding to that API could respect that. So you've got a common place to say, Dave Walsh is opting out, and there could possibly be a half a dozen different technologies underneath of that API that are respecting the rules of the road, if you will, and would say, somebody's asking for information on Dave Walsh and he's opted out, regardless of the solution that is doing that. Otherwise, you're going to wind up with each solution being able to handle that by themselves, if you will, have a mechanism for me to opt out of them and so forth. So I think as we look at interoperability moving forward, in my opinion, APIs will be a piece of what we're doing, a significant piece of what we're doing. And I think as I look at Pradeep's spreadsheet, I can envision that potentially happening through an API where then you write the rules of the road. Here's how different modules in that are going to respect the rules.
Mm-hmm. Interesting.
So I'd be real interested to hear anybody else. I know that's maybe a little bit more technical level or a little bit deeper dive into some of this. I think when we look at this plethora of new solutions and new capabilities being out there, it would be great if we could kind of bundle them together into something that has clear expectations. So I'd love to hear some response from folks on that.
I'm hearing from teams that we work with, this is Ford, that exact, the call for that need.
Mm-hmm.
And I'm hearing it, you know, maybe is in a lot of different formats, but it's sort of the general need for this, this definition, if you will.
Yeah.
And there's a lot of, what I'm seeing is that everybody's inventing their own data definition layer and their own API definitions.
Right.
And the conversations are, and then you have to invent your own security behind them and da-da-da-da-da-da-da.
The antithesis of interoperability.
Yeah, I mean, it's interoperability maybe, but it takes so much effort to get there. It's more contrived than truly, you know, integrated.
Right.
So, I mean, it's almost like it'll work on a bench top in a lab, but is it ready for scale? That's the, and I think that's the, and I'm finding people that are individually smart and dedicated and passionate about this that are making headway, but in the, you know, are we to the place where we can teach people and run courses in universities to train people on how to do this stuff? It's like where nursing informatics was maybe 15 years ago.
Exactly.
When we started building those programs, and now it's gone so far. That's a great example of kind of where this can go.
Yeah. And James, are you still on the line?
Yep, I am.
Yeah. So would you weigh in on that for us? On the concept of a potential API that abstracts functionality and that says, here are a set of well-defined interfaces into the functionality. Now, if you have a product that can provide that functionality, that's great. It can clip into the API, if you will.
Yeah, absolutely. So I think this is one of the reasons that some of us are sort of excited about FHIR and sort of a new wave of utilizing APIs that are available. If you're establishing sort of the pre-existing conditions around what information needs to be shared in order to access the data that's available in a particular system, then you sort of are reducing the likelihood that you have to do some workarounds for matching. If you're defining what information needs to be included in a request in order to access that information, if everyone that's a part of that sort of closed system utilizing that API to access that information is under that same understanding, it sort of simplifies the process of patient matching to the point where it's sort of defined at the API level.
Right. So one thing that somebody else going to say something?
I was just going to comment that what it sounds like you're trying to describe here is what a modern sort of microservices architecture looks like.
Exactly.
Behind an API brokerage and a BFF structure, right? So that, I mean, that sounds like where we're going, and that's what I'm hearing. The industry, everybody wants to get there, but I think it's we got to, like, the path to get there is not clear.
It's some work. So Pradeep, are you familiar with APIs yourself, or? Are you still with us, Pradeep? So he may have had to run for a moment, but one of the things that we could consider, Daniel, is because I think the Let's Get Technical group over time will certainly be starting to address open APIs and so forth. If we were to look at open APIs and say, can we express the rules, the constraints, the use cases, and so forth that Pradeep is expressing in the spreadsheet, then that may prove that it can be done using APIs, or whatever restrictions that we may have that we can't accomplish it through APIs. It's a thought.
Yeah, I guess one of the things in terms of the, that kind of solution, I wonder if one of the things we want to address also is, let's say we go through this analysis, right, and we have an overriding sort of template and then a number of, 6x6 templates that sort of cross-tab with each other. Can we highlight those issues that are really the inhibitors of the blockers, right? Is it a technical challenge? Is it the requirements, the sort of the security requirements for one domain, one program is so much higher than the others, or so specified that it we wouldn't be, others couldn't participate. That's, what are the bottlenecks here that we can point at and say, well, what is getting in the way? Or maybe we're finding that there's actually not. It's more of a definitional kind of thing. It's a different technology, so your API solution may be the right one to sort of cut through it. Because I think one of the outcomes would be, so what's inhibiting us from being able to do cross-domain, identity work here, or matching work? That's really the outcome. I would, if after all this conversation, I think, what's enabling it and what are the inhibitors? If we can answer those questions in some level of specificity, I think that would go a long way to what the right answer is here, right?
I agree.
So I'm going to add that in here. So I wish I could talk and type at the same time. Okay,
I like this conversation. This just came up yesterday, actually, in a conversation I was having about how to provide a useful, it would be part of this patient matching component as a microservice that could be used as a more efficient means within a provider network, or a mixed use network, for providers and social organizations. So this is a present conversation, and it's and the question was a little bit is how would an organization like that's trying to go put this together and field it, how does the use case flesh out? Right. To take it outside of a region.
Yeah, and the other thing that I see is if you take the microservice approach as kind of the model, to me, I envision a dozen different microservices out there being able to perform specific functionality. Yeah, that could be AI, it could be anything. But then the AI being, the API being the gateway to that. So you make a call to the API and the appropriate microservices are called asynchronously and so forth. So I see it as a focal point from which we could develop a lot of solutions, particularly microservices.
I like that, and that's exactly what I had in what I was envisioning as I was speaking with this team yesterday. And some of the questions were, where was the brokerage going to be? Who's going to actually, what is the ecosystem into which this fits, and what organizations are going to play what roles, what actor roles within it.
Right.
Because it was clear that we couldn't do it alone.
Right. Right.
Those are great questions.
Yeah.
Okay. I'm glad to hear someone else typing. It's good to know. Marcelly thinks I'm trying to sort of capture some of the thinking here. We have been able to capture in the chat. If you go on to onto the actual hub, there's in the events section. I want to show this to you. That there's a way to capture the conversation out of the chat, so that we can take advantage of that. So I'm just adding your thoughts here, just in case that doesn't happen. So I want to see if kind of what next steps are, because we're as usual we're filling the time, so there's been no dearth of that. Given it's 1:15 right now. So I guess my question is, there was a group of folks who identified themselves as part of the project team. I guess what I would ask is, would anyone else want to join that? And can you guys meet sometime next week? Either find a time together, or we can facilitate that. And try to advance this work a little bit further, whether or not it's sort of defining the matrix and the rows more clearly, and be able to have something we can talk about next. And I think that for this to work, that there does need to be some ongoing sort of contribution thinking that's going to go into that. Coordinating that is a important function here. Anybody else want to join the team, so to speak? And I will make that happen. Don't all jump at once here.
Hey, sorry, this is Ford. I was on mute. This is the first time I've been really present for an entire meeting in the last month, because my schedule's been whacked. But I'm here moving forward, and I would love to be a part of it.
Great.
You can add me also to this piece. I have a clinical composite data dictionary that might be helpful.
Thank you. Okay, so anyone want to be taken off of the list? I can do that. You can say that publicly or not. Ideally, that this continues to grow, and that there's more participation as this goes forward. Okay, so I'm going to assume that that this is the group that's going to meet. Just coordinate. I know there's a number of conferences next week. I'm out at Medicaid Enterprise Conference. I know some people are at ONC and then also at Chic. So it might be a little difficult, but while we're here, does it make sense to just pick a date and I can send out a meeting notification for a day next week? As I think doing a doodle will be rather challenging for folks.
This is Ford. As soon as I raise my hand, I have to say that I'm at Chic, and then the ONC are back to back 5 days next week. Unfortunately. I might be able to. I don't know what the schedule is. It's one of those I could probably duck out and take a call. Yeah. But it's unclear yet.
Well, let me do this. As opposed to trying to solve this problem right here, right now, I think part of it is going to be important. there's somewhat of a self-managing function to these groups that will be important. That one of us obviously would love to participate in. I'm not sure we can all do that. That's also part of the reason for being online and doing it on the hub or on a a shared document, is to be able to sort of asynchronously add to the thinking on that. I don't know if we're all the way there yet, but it certainly is a goal that I'd love to see us get to at some point here. And there is a point that was brought up that because a number of people are going to be out for a lot next week, I'm wondering if we should postpone next Friday's call. How many people, just by a quick vote, will be sort of either traveling or otherwise occupied next week? Any people? I know a couple people already said that.
I'm out.
I'll be out. This is Neil.
Yep, I'll be out. This is James.
This is Pradeep. I'll be out.
Anyone else? All right, so maybe what we'll do is maybe we'll postpone that. And then what I can do is we can send out a note. We can sort of figure out a time to get together. You guys can. I can send the slides and the notes to folks, and then also post it on the website. And ideally, people can start to go into that. Let me just take a second here. If you haven't seen it. Let me just make sure that everybody is aware of the site itself. If I go to my Google, if I go to my site here, you guys, are you able to see my my screen here?
Yes.
Do I have to change screen? Okay. So when you go into the Collaboration Hub, there's a main page here. Just to do a quick moment here for folks who may be new to this. So this is the main page right now. It's got a lot of information, welcome, new news that's coming up along here, and then the various groups. So we're at the Let's Get Technical group here. So you can go in if you just do need to register for the site if you're not on the site. And there's now 192 people who have signed up. So there's a lot of traffic on this site. So you get to this page here. And there's right now what's happening is we're capturing the past sessions here, part 1, part 2, part 3, and we'll put today's up there as well. There's in the event itself, this was the call for today, and there's some various topics, and then there's a featured project here, so identity proofing and patient client matching, and that's that brings you to this page. And there's a bunch of comments around here already. So Noam and Neil and Eric and Larry and some other folks have been adding comments. So there's a good bit of conversation here. I can add documents and links on this page. This is probably the best place to be doing this conversation since it's linked to the project itself. And we can communicate doing that. You can invite more people to it here. And maybe we'll all do that as well. It would be great to get your feedback on, how this is working, and if there's suggestions for making it work more effectively. I know there was a request for a wiki. I don't believe this. This is built on a NIC. I think they're 3rd generation NIC. So it's pretty flexible, and we can do some customized work on it, some customized development, but it's not perfect yet. And we were hoping to find. We're hoping to find, a better platform. We haven't found anything better than this one right now. So, any questions? And then what I'd love to do is just ask Paul or Brian or Dave just to say a few words about the NEAM conference yesterday, because I think that has particular relevance to what we're doing here.
So, Daniel, just a couple of thoughts.
Yeah.
If we're going to postpone stuff for next week, then there probably is time for you to do a doodle poll for the following week.
Yep.
Second, wikis would be helpful, but another thing that would be helpful would be threaded conversations.
Yeah.
One of the challenges that we have now is that there's basically one line of conversation, and so particularly when we're trying to separate the identity proofing from the client matching, there's not an easy way to do that. So you want to both consolidate everything in one place so it's easy to find the conversations, but then you want to thread them so that you can follow a path so that so each individual conversation makes sense.
So one way to do that might be that we have a project for each, right? Right now this has identity proofing and patient matching. Maybe what we do is we just have a one for the patient matching. We have a separate project for identity proofing, a separate one. So we have a series of those projects, and then within that, you know, you can have the, I think if you're saying what's the threaded conversation here, we can be responding to the individual conversation within that particular topic.
That would help a little bit, but the challenge still is that you can't thread the conversation. So let's say we separate things out. So I laid out 6 steps in a authentication authorization process. If you wanted to go and follow one of those down a path, they would all be intermingled. There's not a way to create a separate threaded series of conversations, even if they were separated from the client matching.
This is Adam. I just want to bring up something that confused me a little, so maybe it did others. When we are talking about postponing next week's meeting conversation, are we talking about the working group, the project group team, or are we talking about this Friday call, or both?
Well, I think for sure the project team, because they're not, it doesn't sound like
I agree. I agree.
time for that.
I agree.
I guess the question is whether we just hold a call. We have some other things to be talking about as well. There's a cadence to this that's useful. So we can discuss that offline and figure it out. We can definitely separate the project.
I agree.
The project from that. But good point.
I think we ought to hold the Friday call, just for the record. That's my 2 cents.
So let me go back and see what, if I'm understanding this correctly. So, I mean, if we separate out each of these into specific projects, we could have 2, 3, 4, 5, 10 projects on here. You could be commenting on each of those. But within the project, Larry, are you saying the reply to, let's say, your 6 steps here, you'd want to go deeper into that in a different way?
Well, so again, part of my makeup is that I think hierarchically. And so I think that it's helpful to talk about what are the high-level concepts and then take each individual concept and then flesh them out more. And as you flesh things out more, if you don't have a threaded conversation, you end up with one person talking about one thing followed by somebody talking about something else.
Yeah.
And so this is where a forum is more helpful because you can have a topic that you then follow, and if you're not interested in that topic, you can just ignore it. So you have in a forum, you have both everything together because it's all in one place, but also you have a threaded conversation so you can pick the conversations that are relevant to you.
Yeah.
Don't you have the capability to set up separate discussion groups by topic and within the hub, Daniel?
Yeah,
but the question is, will it support threaded conversations?
Right.
Can you parse off a new conversation?
I think it depends on how you identify them, right? So let me find out a bit more about that, because I think it may be more of a naming convention, right? So, for instance, if we set up as opposed to, you know, Larry's post, we can have like what I'm showing here, innovative information sharing administrative data as a strategic asset. This could be, you know, let's say, you know, APIs. And this isn't a blog, but it could be in a comment, or this is not a good example of it, but it could be in that forum, like in the discussion forum. So we could have a variety, you know, agendas for the topics, you could have summary, and then you could just work off of those. So it depends on how you name them. And as long as we were clear about, you know, the discussion was all about that particular topic, then you could actually use this to do that kind of threaded conversation. So you could stay focused on it. We just need to provide some instruction for that, for how you do that, right?
Yeah, I was just thinking that maybe a 3-paragraph tutorial would be helpful.
Yeah.
Yeah, but I think the capability is there to have threaded discussions the way you're talking about.
We just need to know where that is, because I haven't seen it.
Yeah.
Yeah. So part of what we want to do is be very clear about, you know, get more clear about that. I know we put up some tutorials. I'm not sure if they are specific to that, but I can ask Sundays to be very clear about that. And because we have different sections, it's easy to get lost here. What I suggest you do is look at discussions and then look at what we were trying to do is organize it by the actual event itself. Like today's event would be a specific set of information. So we'll post the video, audio we're talking about, the slides on that, and if there's any other materials. So that would be specific to the event. But then the other cross sectors, how do you have that conversation that goes beyond the particular event? And that would end up probably being in a discussion. So let me take that back and see what we can do. We are at 1:30. Brian, are you on the call here still with us? Or are you on Amtrak World?
I am still in Amtrak World, but still available.
Okay, so maybe one of the things we can do next week is kind of go into more depth on that NIM that NIM conversation. But can you give a headline on that? I know people are running, but just a quick headline on what came from that and where we're going.
Sure, we had about 22 direct participants. This was just my rough count. In the room, about 8 people virtually. We had some great presentations. Thank you to Dave Walsh and Paul Wormelli and Gene Hall for good presentations, and Chris Traber as well. We ended up with 7 agencies or organizations that were interested in co-leading a NIM Health domain or community of interest. Of course, they're interested. That doesn't mean they're approved to do so. So there's still a little bit of work to be done before we end up standing NIM Health back up again. It sunsets on September 6th. We're hoping that by the 6th we have managed to work out the details for keeping it alive, so that there's no downtime. We also, as a side effect of side conversations at the meeting, it appears that Dave Walsh's notion of NIM on FHIR, that is NIM messages being exchanged using the FHIR protocol, is gaining some traction. And next week I'm presenting it to the NIM Technical Architects Committee and see whether or not people throw spitballs or salute when I run it up the flagpole.
Great.
That's it.
Okay. I think, are you comfortable sharing that PowerPoint? I mean, for folks who want to look at it, or you want to hold that?
I have no problem sharing that PowerPoint, and I will do so as soon as I am a little more stable.
Okay, what might be great, Brian, is just to put it under a discussion. Make some comments on that. It's a great place to have a discussion. Here's what we did, and then put you can just attach the slides, because I think there's a lot of interesting ideas coming out of that.
More than happy to when I'm not rocking back and forth in a train.
Right. 18th century trains getting you from place to place there. Well, thanks everybody. Again, apparently we're not having any trouble filling the time. I hope this was useful to folks. We're still making a bunch of sausage here, but I'm encouraged by the thinking that's going on and sort of making progress in this virtual forum. So we will continue to, meet, help organize it, and try to drive towards some, some products and some solutions, or some products that are, valuable, and we can demonstrate this cross-sector work, which is really hard. Last point I want to make, we had a conversation earlier this morning with Dave Ross, who runs a global health initiative for the Gates Foundation, about this cross-sector work happening. And he was expressing both interest in what we're doing here, but also to share some experiences of what's happening globally and some of the successes they're having with data capture and data sharing and analysis across multiple domains, which kind of blew us away. And it's interesting that, when we bring up this topic to other people in other sectors, there's a huge interest in what we're trying to do here. So we can talk about this, but at another date, he offered to come and talk to us about the Global Health Initiative and the successes and the technologies that they're finding to be successful in all parts of the world. So we can enlarge the conversation here. We can go more to thought leadership occasionally, as well as dive into sort of the details that we've been doing from time to time on this call. So appreciate your thoughts. Add comments, suggestions, invite other people to the meeting, and have a great weekend. We'll hopefully see some. I'll be at MESC for those who are there. Dave Walsh will be there, and we'll be having our interoperability mural gallery, so come see us there. Or folks who are at Chic. I know that Dan Chavez will be there, and other folks who are on this call. So hopefully you get a chance to meet up face-to-face. And with that, we'll see some of you next week, and we'll see hopefully the rest of you the week after that. So thanks for hanging in. Yeah.
Thanks, Daniel.
Thank you, Daniel.
Thanks for hanging in, everybody.
You, Daniel.
Okay, bye. Ciao, everybody.
Bye. Thank you.